Nobody wants to keep coming in and out of the hospital or visiting the emergency room. There are certainly definite advantages and a better quality of life if one is able to stay at home and that they feel well and that they can do the things that they enjoy doing at home. So if I'm taking good care of myself, making sure that I'm taking my medication, my blood pressure's in check, I'm not gaining too much weight because of excess fluid, I'm going to feel better.
You know, patients that come back in 30 days do not usually do that well when they come back to us. And number two, Medicare decided in the last several years that they would begin to penalize hospitals for patients that are readmitted within 30 days. And our readmission rate was sky high. So we decided we had to really look at this and come up with some plans to help reduce this and improve our patient care.
And there's various disease entities that have been selected to focus upon, and those include MI, CHF, and pneumonia. Patients come back within 30 days, the hospital will have to pay for that cost. So we've embarked upon a Vree program, and with the Transition Advantage program that we have been working together on over this past year, we've been able to identify patients who are going directly home with one of these chronic diseases.
Our program is designed really to support patients to ensure that they're adherent to their discharge instructions, that they're taking their medications as prescribed, and that the care liaisons can direct them to appropriate resources such as home health, transportation to appointments if needed, and also making sure that the patient is motivated and confident in following their discharge instructions. The case management staff here at Griffin Hospital will identify patients based on their current disease state. One of the case managers will approach a patient. They will offer the program to them.
And what we do is we go into the patient's room and, explain the whole setup of it, how they'll get the daily phone call, for the 30 days. We have a video that we show them to explain the program, and there's follow-up. And if there is a problem, they'll get a return call to follow up on it. This way they're getting the calls. They're getting the follow-up where if they weren't getting the calls, they probably would just let it go.
And Vree Health becomes involved because we receive a notification that a patient has enrolled. And what happens is there will be what's called a day zero or introductory call, where the care liaison will speak to the patient. They will let them know we're here to support you for the next 30 days, and that they'll next be in touch once the patient is discharged from the hospital.
Vree gets a copy of those discharge instructions, reviews them with the patient, makes sure they go to their follow-up appointments. That's very important. Some of the challenges we saw were medication reconciliation post-discharge. We found one of the main reasons patients came back is because they had issues with their medication. And what Vree Health does with the health coaches, they help go through those medications after discharge. And if they determine there's a problem, they can elevate it to the physician. They have a nurse line and help keep that patient out of trouble.
Take, for instance, that example of someone going home with congestive heart failure. We're going to provide that person with a blood pressure cuff as well as a scale. We ask them to take their weight and their blood pressure and pulse, record it on a booklet that we will provide to them. And when that care liaison calls that patient, that individual will pull out their booklet, have a discussion on what their weight is running, blood pressure, and their pulse. That daily monitoring over a 30-day period is very important because it allows us to catch a problem before it goes too far. Folks go home from the hospital, they quickly get back into those normal activities, which is great, but then they're not focusing on themselves. With the Transition Advantage program, the Vree Healthcare Liaison helps that individual stay on track during the course of that 30 days.
I think the program has wonderful benefits for patients. I mean, most patients, before this program, if they needed a scale, we didn't have them. I had staff going out buying scales for patients until we could get some grant money to get scales. So I think, first of all, being able to give them that equipment before they leave is wonderful for them. Having someone checking in on them every day, I think, is a great asset because I work closely with the liaisons, and when there's an issue, they catch it and we try to address it quickly. And also being that coach to prompt that patient, hey, you have an appointment, are you going? Did you get your prescriptions filled? Are there any obstacles to that is a wonderful thing for these patients. You know, they used to leave our door and we didn't know what happened.